Amid a spike in COVID cases across the country, a COVID-19 mock drill is set to take place in New Delhi today. This exercise will be conducted in all the government hospitals in the national capital. This comes as India witnessed 1,890 fresh cases in just the last 24 hours, with the daily positivity rate also increasing to 1.56%. The active cases have now mounted to over 8,500. Now, the mock drill will take place throughout the day to review the preparedness of the government hospitals across Delhi, and will be a comprehensive analysis of the capabilities of the health infrastructure and the logistics to tackle any spike before it can become a full-blown COVID wave. The availability of the medical oxygen will also be reviewed, and all the government hospitals in New Delhi will have to submit a report to the government at least by the 27th of March. Now, the details of the nationwide drills will be communicated with the states on Monday.
On the directions of Delhi government, the LNJP hospital, one of the premier health center of the Delhi government, have started mock drill under the COVID-19 preparedness directions given by the Delhi government. So this is the second part of the mock drill, where another patient, a dummy patient, has been brought inside the hospital, and now you can see, as per the part of the treatment protocol, that patient will be transferred from the ambulance to the COVID ward, where the treatment will begin. You can clearly see that the attendants of the hospitals are in absolute condition when they have to treat COVID patients. They are in PPE kit, they have the face mask and the face shield, and also the mask on. So this is a complete this is in compliance with the protocols given by the ICMR on the treatment of COVID-19 patients. So all that they have to go through while treating COVID-19 patients, that are being practiced by the practitioner here at the LNJP hospital. And to discuss more, joining us right now is Dr. Suresh Kumar, Medical Director of LNJP. Sir, how significant is this mock drill?
This is the major exercise we are doing. This mock drill is just, we are just checking the preparedness of our staff, our handling of the patient, our oxygen storage, our all equipment, machines, ventilators, BiPAP machines. We are checking whether they are functional or is there any problem in admitting the patients. We are also checking the response time of our staff, that once the patient is received in the casualty, what is the time taken from ambulance to the triage area, and all those who are sick, very critical, who need ventilatory supports, they are admitted within seconds or within the short span of time.
So it's not just the mock drills that are being conducted, but the centre has also given a set of directions to the states across the country to ensure that they take these practices. Let's get you the details of that. Closely monitoring new and emerging clusters, because remember, it's going to be extremely important to look at which are the clusters that can aid in the spreading of the COVID-19 cases. Apart from that, also genome sequences, which is very, very important for the international travelers. So international travelers are also going to be under the scanner. Now, the states have been advised to look at the international travelers who are coming in. Apart from that, increasing awareness for the precautionary dose. Remember, many across the country have still not taken the precautionary dose. So the centre has advised the states to ensure that there is awareness about it. Apart from that, enforcing COVID protocols in crowded places, because that's one of the most effective ways to ensure that COVID is under control. Viewers, you can call us on the numbers that are on your screens. You can call us if you have any doubts about what should be done, because we have experts who are joining us on the broadcast. Dr. Sanjeev Bagai, Chairperson of Nephron, Dr. Rajiv Jaydevan, Co-Chairman of the National IMA COVID Task Force, as well as Dr. Vaishali Salau, Head and Senior Consultant of Critical Care Fortis Hospital. Thank you so much for joining us. First up, of course, want to tell our viewers that the numbers are on your screens. You can call us for any doubts that you have. Dr. Sanjeev Bagai, first want to ask you, according to every metric, as we've seen, the number of COVID cases has seen an increase. But because, we saw such a grave COVID wave across the country a few months ago, a lot of people believe that COVID is now over, we are vaccinated. So is there a reason to worry, or are precautions very important to give us, a sense of what the situation really is like? Do we need to panic, or just take precautions and everything would be fine?
Good afternoon, everyone. I think we need to put the medical facts and science in the correct perspective. Just as important messages, there is no need to panic. The important point to carry home is that we are seeing a surge, and this is global. Very quickly, what we are estimating in global surveys, which is a modeling study which has been published last night, globally, we will see in terms of the new Omicron up to 5.2 billion new cases, more than 30 million hospitalizations, and 16 million deaths. That's in the global scenario. The reason why India is in a very, very better and a well-placed position at the present moment is because of a very, very good strategic and very aggressive vaccine campaign. Coming to where we stand now, what we need to do is we are seeing the new sublineages, which are basically, it has shifted from XBB 1.5 to XBB 1.16 and 1.16.1. That's the great-great-granddaughter of the Omicron, which is now called as Arrakis. We are also seeing what we call as XBB 1.9. Not so much, but the main rampant variant all over the world, including India, is XBB 1.16. This is more immune invasive, more vaccine escape. But the fact where we stand right now is we need very aggressive public awareness and messaging. We need community sensitizations towards COVID-appropriate behavior. Masking is extremely important. Early identification of suspected cases. Testing, which should include RT-PCR and genomic sequencing. I don't think we have done enough pan-India in the last 6 months to 12 months. The important thing is preparedness. This mock drills, which is being conducted very shortly, is going to give a sense of preparedness to the entire medical community in terms of oxygen requirements, in terms of ICU beds, hospitalization beds, reaction time, triage, ambulance services, and most importantly, the drugs and the consumable disposables which are required. Manpower allocation, which is doctors and nurses. And the last important point which I want to drive home is boosters, even though they may not be as effective as they were last year, because this is something which is called as immune imprinting or immune dumping. There is a phenomena in which when you get the vaccines done earlier on, your B cells and T cells get sensitized to give you more long-lasting immunity. At the present moment, this is Omicrons are giving higher amount of breakthrough infections, but still it is going to give you more than 90% protection towards serious cases and deaths and hospitalization.
Okay.
I want the government to focus on the intranasal vaccine. This is going to work wonders. It's going to give you lung protection at the site of entry through what we call as resident memory T cell response. I want the Indian industry to actually have its own bivalent vaccine. It is more effective than the earlier strain against the ancestral strain, and to also have our own data on the heterogeneous regime.
Okay.
We are well placed. There is no need to panic.
You spoke about the preparedness and the mock drills that are going to be conducted, and definitely after the second wave, even in the third wave, the government, hospitals were much better prepared. But Dr. Rajiv, what do people do when it comes to that? Because now with a lot of people talking about vaccines, there are questions being raised on, we've taken 2 vaccines and we thought that was the end of it. Is it not effective towards it? Dr. Sanjeev Bagai just spoke about 16 million deaths across the globe. So, a worry over are the vaccines really effective or not? And now, not just the booster dose or the third dose, but is this going to be a phenomenon that will happen every few months? That, something that was discussed earlier as well, that COVID is here to stay. So this means that we could have to take vaccinations very frequently over a few months.
Well, most people, including me, would like to believe that the pandemic is over. But unfortunately, that is not true. The pandemic is ongoing. It is true that the number of cases worldwide is relatively lower. When I use the word relatively, that means that there are significant numbers, like Dr. Bagai said. Now, as far as India's situation goes, as Dr. Bagai said, there's a significant vaccination coverage in India. In addition to that, many individuals have survived a natural course of infection. Many have had 2 infections, some even more. So those who have survived these infections and have been vaccinated are in a position of what we call hybrid immunity, which means they have a good immune memory that can potentially counter even new variants. But we must also remember that India is home to 1/6 of the world's population, which means a very large area which need not always be fully covered. Say we do have centers of excellence that are doing proactive genomic sequencing, but we do have large blind spots which could potentially be having some sort of a new variant. The reason is as follows. This SARS-CoV-2 virus lives in an average human being for about 10 days tops. But in a subset of individuals who are immunosuppressed, and even in animals, now it's known to live for longer periods of time, in which case the virus gets a long time and convenience to pile on a bunch of mutations. And the emergence of an all-new variant cannot be ruled out. So we must not let the virus out of sight. We must chase it down and not let the virus chase us. That is pretty much what I can say to summarize the government's efforts. And also, I must commend the efforts on mock drills. Mock drills is a concept not just for healthcare, but for so many other areas. For example, fire safety. Now, mock drills for our viewers, I'll give you one simple example. A mock drill is done during times of peace, that is when there is no problem, just to make sure that there is no hitch in the system. For instance, in a cardiac arrest mock drill, if your defibrillator leads are not working, the patient will die. You might have the finest hospital, the finest doctors and nurses around, but if the leads are not working, the patient will die. So likewise, there may be minor hitches that can be picked up by such drills, and that's the objective of doing a mock drill, to make sure we are prepared for any surge that might occur. We hope that will not be necessary.
Okay, all right. Dr. Vaishali, because now there's so much awareness because of the few waves of COVID-19 that we have seen, there's a lot of awareness. So the moment there is an increase in the COVID-19 cases, we immediately see people taking precautions, wearing masks, avoiding crowded places. But do you think now, looking at the number of cases that are increasing, the positivity rate that's increasing, and at the numbers that they are at currently, do you think it's time for the government to take stricter action, perhaps maybe not just avoid crowded places and ensure people are not crowding, but also schools, because in schools there are a lot of children who gather, so to ensure that there's online training back again. Is it time for such strict measures, or do you think that right now the situation is under control, and as long as we're taking precautions, there wouldn't be any reason to worry?
Yeah, so currently I think the situation is still evolving. If you see the number of hospitalizations in Mumbai at this day is in double digits still. So there hasn't been a massive spike in hospitalizations, though they are on the rise. And the government needs to keep a very close watch. And I feel, in my personal opinion, that we haven't, and which the government is doing, and warning the society about what are the total numbers, what are the existing numbers, daily numbers, positivity rate, so that people remain informed and take precautions appropriately based on the numbers. But I do not think that we have reached a stage of panic or reached a stage of taking those draconian measures as yet.
Okay, Dr. Bagai, what about children? Because, they always are, going to schools, and many of them are not vaccinated yet. So what about them? This is a worry that parents have all along. Now that the cases are increasing, what do you have to say about the parents who are worried about children contracting COVID-19?
Okay, so I have so much to say on the children COVID. So just the important salient points. I think children are as vulnerable as adults. They carry the same viral loads as adults. The immune response very often is weaker as compared to adults. Omicron has not spared children. Again, in a recent study last week itself, it has shown MISC, which is multi-organ inflammatory involvement of various systems, is approximately 27 to 33% worldwide of children. Okay. Children have very varied and manifesting presentations initially, and it can mimic any other viral infection. The more important thing is that most of the children are asymptomatic, or the symptoms are hidden behind other viral infections. And therefore, these presentations of especially multi-organ involvement comes approximately 4 to 6 weeks after even a mild infection or an asymptomatic infection. So we need a very high index of suspicion. And one important point I want to add in the end here is that I think India needs a comprehensive healthcare ventilation policy. This is something which we've been talking about, but I think we need an implementation policy. We need something which is workable for schools, for hospitals itself. I must add that healthcare facilities, ventilation policies are pan-globe, not only in India, are outdated.
So it needs to be taken more seriously. My sincere apologies. We have a viewer joining us, Arpit, on the phone line with us. Thank you for joining us. Arpit, what's your query?
Yeah, good afternoon to everyone. My question is, I have two questions. First is that are the current vaccines which are there in India, are they efficient to combat the current variants, because they are prepared in view of the original SARS-CoV-2 virus? So will they be efficient against these new variants of that is X1.16 and B1.16 of Omicron? And the second question is that why is it so that at a given time, only a certain or a particular variant of COVID is dominant. Now, why are the other variants get suppressed? Like once there was Delta variant which wreaked havoc in the nation. So where has it gone? I know it hasn't been eradicated. But why it is so that the effect of one variant becomes dominant and others?
Okay, all right. So why are the vaccines, I mean the vaccines that we have taken, are they efficient or not? And another, why is it that at one point there's just one variant that is dominant? Dr. Sanjeev Bagai?
Yeah, so to answer both the questions very quickly, I think the vaccines which have been made are for the original, what we call as the wild strain or the ancestral strain. And subsequently, we've seen alpha, beta, gamma, delta, eta, and now Omicron. And Omicron has more than 1,000 sublineages. The reason why the vaccine's efficacy and effectiveness on the ground in real-world data has decreased is because the nature of the genomic changes and amino.
Okay, all right. Dr. Sanjeev Bagai, thank you for joining us. My sincere apologies.